Welcome to ESC TV. My name is Stephan Windecker. I'm from Bern, Switzerland, and it's my pleasure to interview my friend and colleague Jean-Philippe Collet, who is a professor of cardiology in Paris at Pitié-Salpêtrière Hospital. Welcome, Jean-Philippe.
Thank you very much, Stephan.
Jean-Philippe, you are the session coordinator for Village5, which covers the topics of interventions, peripheral circulation, surgery, and stroke. Can you introduce us to the most important highlights of Village5?
Yeah, first of all, I would like to thank all my colleagues who actively participated to this outstanding program. And I think an easy way to summarize the topic of the Village5 is it is the village where interventionalists should be. It's not only interventions, but it's coronary interventions, structural heart disease intervention, and also peripheral artery disease intervention. It's not only interventions, because it's also all the things that are around interventions, pharmacology, and there is also a special focus for systemic organs that are related to the heart and especially the brain.
So actually it covers a very wide field, and the field is driven by innovation. Can you tell us a little bit what will be the most important innovations this year at ESC 2013 in Village5?
Well, in the organization, there will be rapid fire session, which are, very small sessions of 5 or 6 minutes with very different topics, and very good chairs so that you can have a real summary and very fast. And this is for pharmacology also, but this is also for long-term revascularization, results for surgery, but also new stents. And this is also for pharmacology, and especially the new paradigm for the treatment of stroke. So a very broad aspect of all cardiovascular intervention.
So it promises to have a lot of interaction and debate within this village on the topic of interventions. Now, one of the highlights of ESC is obviously every year the presentation of hotlines and clinical trial updates. Could you highlight for us what will be the most relevant ones for Village5 and the topic of interventions?
Well, for interventionalists, I think that the TASTE trial would be a very interesting trial. It's about, thrombus aspiration devices in elevation myocardial infarction, and it's still an ongoing debate as to whether it would reduce mortality, and I think it's clearly a topic related to Village5. And then there are also pharmacology, trials. There is the COAST trial on pre-treatment, with high-risk ACS patients, non-STEMI patients who are referred to the cath lab, and we do not really know how to treat them and when to start the treatment, and I think this would be a very important information for interventionalists. And finally, I would say the TAO trial with the otamixaban, which also refers to ACS patients who are sent to the cath lab, so a new anti-TNA. So we're going to have lots of very big, hotline stations which are related to Village5.
Well, thank you very much, Jean-Philippe. Indeed, it sounds like a very promising village to go to, and including very interesting clinical trials and trial updates. Thank you very much.
Thank you, Stephan.
ESC Congress 365 is your free access to ESC Congress content all year long.